Howdy, my name is Jay Holmes. I'm the men's swimming coach here at Texas A&M.
Howdy, I'm Dr. Garth Morgan, a primary care physician with CHI St. Joseph Health.
Diabetes is something that touches us all. We all know people who have it, whether it's a family member or someone that's close to you. From a coaching standpoint, I've had several athletes here at Texas A&M who are diabetic. I've had a couple in the past, and I currently have a guy on my team that is diabetic.
Diabetes is a disease where your sugar controlling mechanism is broken. When we eat food, we get several things from it, and one of them is sugar, and a big sugar is glucose, but our body can't process it. So we secrete a hormone called insulin that's supposed to take that glucose and put it into storage. It's struggling to do that. The sugar levels rise, the insulin levels rise, and it makes you very tired, makes you very sick, and later on starts to cause problems with blood vessels and eventually heart attacks and strokes and kidney failure and all kinds of problems.
For these guys to be on my team, to be representing Texas A&M at this level, there's some things that they really have to be on top of. They have to constantly be aware of their blood levels. They have to be aware of their diet. They have to be paying attention to all these things that us as normal people maybe never have to do.
There are two different types of diabetes, type 1 and type 2. 1 is a genetic problem that when you're born, your insulin producing cells have a short lifespan, and by the time you're 10 years old, they're basically gone. And so you have to have insulin given to you by injection. Type 2 diabetes is almost self-induced. It comes about from your system seeing too much sugar over your life, and you've lost the ability to control that sugar.
There are several things that we as coaches are looking for when we have a diabetic that we are paying attention to. One is their hydration levels. 2 is probably headaches, if they're getting those a little bit more common than maybe would be normal, and the last one is just the fatigue level. Those are probably the 3 things that we are particularly looking for. There are other symptoms of diabetes, but just where we are, those have been kind of probably the ones that we're just at least taking note of, we're paying attention to. And our athlete knows, if they're diabetic, they are paying attention to those as well.
So more than 1 in 3 Americans are actually pre-diabetic, which means they don't have diabetes yet, but their sugar numbers are high enough that they're at risk. So we need to make sure everyone gets in and talks with their doctor to find out when they need to start screening. At CHI St. Joseph Health, when we see patients, we definitely are following the established national guidelines, but we think we do it with a little bit more personal touch. We tailor things to the individual person, and we treat our patients like they are people, not just the next person in line. You can learn more about preventative care and diabetes management at stayhealthyags.org.